friend just said. Yes.
I thank my honourable friend for giving way, and I just briefly draw members' attention to my declaration of members' interests. I was, until recently, an acting consultant addiction psychiatrist. Just on the point of other uses, legitimate medicinal uses and legitimate industrial uses of nitrous oxide, moving the nitrous oxide away from the psychoactive substances regulations to the Misuse of Drugs Act does put a number of limitations on its use in its current settings. Could I ask what consultation my honourable friend of the department has done in advance of bringing these regulations tonight with the medical sector as a whole, and also with other commercial providers or users of nitrous oxide?
Sir?
Thank you. Well, we have conducted further engagement and consultation with the oxide of nitrous oxide does. Yes, of course.
I think I don't wish to be disingenuous to the Minister, but the ACMD were very clear that they did not believe that the medical harms of nitrous oxide pose anything near the significance of many other drugs, street drugs, or indeed, if we look at the harms of alcohol-related brain damage causes much more neurological harm than indeed almost many street drugs do. And I think it would be helpful for the Minister just to correct the record on that.
Well, look,
Minister.
I think I've referred to the ACMD.
Dr. Daniel Poulter.
Brilliant. Thank you, Mr Deputy Speaker. It's a pleasure to follow the Honourable Lady, the spokesperson for the SNP in this debate, and I don't disagree with much of what she has said. I believe that the government will achieve very little through these measures this evening, except perhaps to cause considerable disruption to industry and legitimate medicinal uses of nitrous oxide. And I'm far from convinced from the changing reassurances that the Minister gave in that respect at the dispatch box. I'd once again, Mr Deputy Speaker, draw attention to my declaration of members' interests, the practising NHS psychiatrist who was working until recently as an acting addictions consultant psychiatrist. And I have dealt with misuse of drugs quite extensively throughout my medical career. What I would say is that I believe in an evidence-based approach to policy making. And I believe that we have had this issue examined at the request of the government by the ACMD, and the ACMD very clearly suggested that this was not the appropriate legislative vehicle to deal with nitrous oxide. And they made, I will of course give way in a second, they made that recommendation for two reasons. Firstly, because we already have a Psychoactive Substances Act that if you want to deal with the illegitimate sale and supply of nitrous oxide, that there's legislation already in place to do that. And secondly, because we have other laws that can be used to deal with, for example, the unacceptable littering that sometimes occurs with some of the canisters that are used, that are involved with the recreational use of nitrous oxide. And of course I'll give way.
I'm very grateful for giving way. Is he aware that the ACMD was asked many years ago to opine on this, and they were chased up by two Home Secretaries in order to try and get a response from the ACMD on exactly this point? It wasn't until this SI was first talked about earlier this year that the ACMD actually did get around to actually answering the request from the government to make a judgment on it.
Yeah, I'm aware that it takes some time to compile ACMD reports, and the reason for that is because the ACMD likes to look at the evidence in the round, and there are a number of issues to look at here. There are the harms of use, and there is relatively limited evidence and data actually that actually would suggest that nitrous oxide is substantially more harmful than many substances that we use daily, like caffeine, for example. If you use caffeine to great excess, that has very profound immediate health consequences, and indeed alcohol. And the point was made by the honourable gentleman about the Notting Hill Carnival and the number of beer cans or other forms of rubbish that were left there. Well, if we look at the social and health harms of alcohol, which is a legal drug, and one that is misused legally, that is considerably more profound than what we're talking about here, or indeed when we talk about many other street drugs. And of course, I'll give way.
I'm most grateful to him for giving way. Can he just clarify to the House what his conclusion is on this matter? Is he saying that he opposes this measure, or is he saying if this measure goes ahead, he wants the government to keep the matter under review?
If the House decides this evening, I'll be voting against this measure for further reasons which I'm about to outline to colleagues. So I think it would be helpful just to remind the Minister, in fact, of what the ACMD actually said in terms of legislation. And it said, based on its harms assessment, the Psychoactive Substances Act 2016 remains the appropriate drug legislation to tackle supply of nitrous oxide for non-legitimate use. There is, however, a need for enforcement of the Psychoactive Substances Act 2016 to be supported by additional interventions designed to reduce health and social harms. Based on this harms assessment, nitrous oxide should not be subjected to control under the Misuse of Drugs Act 1971 for the following reasons, and these are, I think, have been drawn out to some extent during the debate, but they're neatly summarised by the ACMD in their recommendations to the government in their report. Firstly, the level of health and social harms are relatively limited, and current evidence suggests that the health and social harms are not commensurate with control under the Misuse of Drugs Act 1971. Secondly, proportionality of sanctions. The offences under the Misuse of Drugs Act 1971 would be disproportionate for the level of harm associated with nitrous oxide and could have significant unintended consequences. And thirdly, the impact on legitimate uses. Control under the Misuse of Drugs Act 1971 could produce significant burdens for legitimate medical, industrial, commercial and academic uses. The current scale and number of legitimate uses that stand to be affected is unknown, but is estimated to be large. And I think it was fairly clear that the government hasn't done a proper assessment or impact assessment of that before bringing this measure before the House this evening, and I will give way.
Thank you, Mr Deputy Speaker, and I thank my good friend for allowing me to intervene. Does that mean that the honourable gentleman thinks we should do nothing at all?
No, I don't think it means we should do nothing, and I think that if you believe, as I think a lot of us do, that we want to control the illegitimate supply of nitrous oxide, then we should look at existing legislation, which is the Psychoactive Substances Act, which was designed, and if that was taken through indeed by my honourable friend, the member for Hemel Hempstead, and this point was discussed at quite some length during the passage of that legislation, that the focus here was not about criminalising use, it was, potential people who are using, it was about actually controlling the supply, and there was a very clear distinction drawn. What we've seen, though, is that there has not been, I think the Minister may correct this, but I think the ACMD made it clear in their report that actually better enforcement of that legislation would be, which already exists to control the legitimate supply, would be a much better way of dealing with this, and a much more proportionate way of dealing with this issue at hand. And indeed, that is what the evidence more broadly that was supplied to the ACMD as part of when they were compiling their report also suggested. So there is already a legitimate means of dealing with this. But unfortunately, when we have potentially unintended consequences, and I'm not at all reassured by what the Minister said at the dispatch box earlier, that we'll be bringing another measure forward, which no one in the House is currently cited on, to make sure that there aren't unintended consequences. Well, actually, if you're bringing forward good legislation, you should bring forward both pieces of legislation together so that the House can consider them in the round. Now, my concern is that because the Misuse of Drugs Act 1971 is primary legislation, is tightly drawn, that it is very difficult, unless you amend that primary legislation, to bring forward another piece of another measure that sits underneath it that is going to mitigate against what that primary legislation says. So I think that's something that I'm not reassured by the comments that the Minister has made in that respect. But in any event, it is not good government, or indeed effective government, not to put that measure forward for the House to consider at the same time, so that we can consider these issues in the round. So for those reasons, because I believe that there is already legislation in place that needs to be better enforced to deal with the legitimate supply, because I don't believe the government has given enough adequate weighting or consideration to the potential unintended consequences of this on legitimate uses of the nitrous oxide, and that was effectively admitted by the Minister in his opening comments by the lack of assessments that were made. I'm afraid I believe that the government is in the wrong place on this at the moment, and it would have been better to have actually brought forward a proper impact assessment on legitimate uses, put that alongside this before asking it to be brought to the attention of the House. So for those reasons, Mr Deputy Speaker, I will be voting against this measure this evening if it's called to a division.
Thank you very much. Justin Matters.
Thank you, Mr Deputy Speaker.